This is my dog when she wakes up from teeth surgery. Wow. Wow, wow, wow. There are 3 different shots that are typically given in a psychiatric setting when a code goes off. And these would be between a B52, Zyprexa, or olanzapine, and Geodon, which is, I will tell you a little bit later. Let's jump right on into it. Sorry if I keep moving around a little bit. My doggy just had surgery, and she won't leave my side, so she is in my lap right now. But first, being a B52, that's just what in the psychiatric setting it's called. Should it be said? Should we use it? Should we call it a B52? Up for debate. But Benadryl 50, Ativan 2, Haldol 5. If the patient is willing to take it in the PO form, that's great. It just takes a little bit longer to kick in, 30 minutes to an hour. But if they are willing to take it, though, by shot, it's my second favorite one that is used because, first and foremost, patient safety, the safety of the medications given together, minimal side effects. To date, Leia. Oop, my dog almost falls. Now anyway, back to patient safety with the B52 given. I think it is a shot that should be given more frequently because of the minimal side effects that are caused and also adverse events happening. Now, once again, I'm not saying this is for everyone. There can be allergic reactions to it, but if they've never had it before and there's no reaction reported, in my opinion, it's a great medication to be administered. Now, number 2, olanzapine or Zyprexa. Zyprexa is an interesting one because in a code situation, it's not my favorite at all because it's just not that effective. It's a shot that can be given if a patient is starting to get, build up, but you can give it to them in time, meaning something bad was going to happen 30 minutes down the road. It's more of a preventative. Yes, effective. One big side effect, though, is, especially with the IM form, is a lot of times the prolonged sleepiness. But once again, being used if somebody's telling you, look, I'm gonna flip out, and they're allergic to, let's say, Ativan or something, or a Haldol, or even Benadryl, or the doctor just wants Zyprexa or olanzapine. It is good. It is. Tiredness. Weight gain can happen long term with the pill form. However, I will say with that, compared to other antipsychotics, I don't think it's near as, I don't think from what I've seen, weight gain is not something that actually a lot of times with patients who are taking it don't occur. Now, can it? Yes. And it's listed as a common side effect, but a lot of times they just I think there's a lot of, in my opinion, stereotypes in regards to the antipsychotic class of medications. But from what I've seen, I think Zyprexa is great for somebody also suffering from something like schizoaffective disorder, even sometimes I'm not even a major depressive disorder, but even just extreme anxiety. But in a code, no, I don't like that one. Now, number three, the final one. This is my favorite, Geodon. Geodon is my favorite because when given to a patient, if the B52 doesn't work, having Geodon on deck is always great to have. Now, the one thing that can be a little agitating about it is sometimes when you're pulling up Geodon as an RN in a code, sometimes pulling these medications up can be really tough. So that's why it's my favorite one because of its effectiveness. However, when it comes to drawing up meds with, like, for example, a B52, you can pull up Ativan, because Ativan, let me just put it this way. and vial is very, very sticky. It's a sticky medication, right? Very sticky. And with it being that sticky, pulling it up with a blunt needle, you name it, it's hard to do. You can mix Haldol and Ativan together. So you pull up the Haldol first, then you push it in to the Ativan vial, draw it up because it makes it a lot more thin. Haldol is not thick at all when you draw it up. And Benadryl you do separate because you can't mix them with either. And you can pull it up really quickly. You can get really good at it. But no, still I do like Geodon the most, just because it's kind of, in my opinion, like the godfather of them. And I'm not including Thorazine, because I know a lot of people would say that because of in my opinion, Thorazine can really cause long-term memory issues, even given in IM form. I know it's still given today, but it's something that I'm not actually fond of, because it will knock someone out for days. And I know sometimes that might be the case in some scenarios if they haven't slept in 2 weeks, let's say. So there are situations where it could be, but it just, even in, like, I know the jail system, it's given a lot. And I know I've even heard of patients who've just brought up before, when they were in the county and whatnot, that they would refuse the Thorazine because people who were on it, the Thorazine shuffle would happen and their memory would just be gone. And you'd say, oh, just when they're using it or going to sleep. No, like, once you start it, it just takes it. But Thorazine is effective, but I just don't like the practice of it. But also, I will say, to finish up on this quick video, that I will be doing another video in regards to Zyprexa, Haldol, and Ativan shortly, covering a lot of. I'm going to be covering it from a PO perspective, meaning by mouth, the oral form of it. I'm going to be doing a more in-depth look and just kind of things, common questions patients have, or even from there, things that I've seen, what I've seen being effective with these medications. And this isn't just in an inpatient setting, outpatient as well. A lot of these medications are still prescribed, but we'll go over the pros and cons of some of these. But that's what I want to do today. Just look at it from a code perspective, like a code in a hospital where a patient's escalating. What my favorite thing is, I mean, I've worked in the field for a while now, so I would definitely say Geodon, but B52 is definitely up there. But I'll have a new video out soon. Like and subscribe. Check out the Patreon. Sorry once again, everyone. My dog did have a surgery today. Had to get her teeth cleaned. But she always acts very weird after it for a while. She always likes to stay attached to the hip. But thank you to all the new subscribers as well. I love you all. More videos coming. Check out 365 Days of Running as well. Let's get it.